Welcome to Nursing Uncensored, the show where I have real conversations with nurses and allied health professionals about all things in the nursing universe. This podcast is meant to bring education, advocacy, and laughter to nurses and students, and nothing is off limits. We're always honest, but we're not always safe for work, so please listen responsibly. I'm your host, Nurse Adrianne Benning. It is a beautiful, cool day here in Minneapolis, Minnesota, and today I'm welcoming clinical psychologist Dr. Saloumeh Bozorgzadeh. I am very excited to talk with her today. She is a licensed clinical psychologist in Chicago, my hometown, which I love dearly. In addition to running a wellness center and a group practice, she provides wellness programs for medical residents and healthcare professionals. She's the current president of the Sufi Psychology Association and the founder of Our Caregivers Initiative, which donates stress-relieving wellness resources to healthcare professionals and hospitals. And that is going to be the focus of our conversation today. In addition to that, she's authored 2 textbook chapters, one for nursing and the other for psychology. Her experiences include workshops, retreats, teaching higher education, supervising clinicians, international presentations, and she's also the recipient of the NBC5 Making a Difference Award. She's got a huge list of credentials, and I'm very excited to have her today. She's also the principal investigator of another study examining the benefits of the Tamarkaz Sufi meditation method, which she uses when she's working with oncological patients and healthcare staff. So I'm really excited. Dr. Bozorgzadeh, it's wonderful to have you on the show. That's a mouthful, but you deserve credit for every single bit of it.
I don't know, but thank you very much. It sure makes me feel good. I mean, when it's read back, you're like, really?
But you know what? That's the thing. We all need to hear it sometimes. We know it. We put it on our resumes, but we need that uplifting, yeah, I did all that. And that's good. So you have done a lot, to your credit, but I'd like to know a little bit more about you. Will you tell us a little bit about who you are and how you came to fulfill these roles that you do now?
Sure. Yeah. So I'm a clinical psychologist. I was born in Iran, actually, and I grew up in California. And then now I'm in Chicago. So I don't know why I would leave the warmth of California for the freezing winters of California, or for Chicago, but I did. I kind of came into Sufi psychology. So Sufi psychology is a practice where you take the teachings of Sufism and you incorporate them into Western psychology. And I came across that really through the benefit that I gained from it, which was, when I was a teenager, I had a rough patch, as many teenagers do, in terms of depression and all sorts of feelings. And it was learning about Sufi psychology and how it was applied to me that really turned my life around. And that was the moment where I decided to go into psychology. And in doing so, I basically been working with a range of clients. My original specialty was high-risk adolescents because of my own experience. So self-injury, eating disorder, substance abuse, suicidality. Then went into a generalist practice, then started focusing on healthcare workers. And basically the last few years, we've been working with the Sufi Psychology Association, which was founded in 1997. We have been working with healthcare workers to combat burnout because it was such an issue. Many people, and I'm sure you know, and your audience probably knows this firsthand, but the general public doesn't really recognize what healthcare workers are going through. In 2018, the highest rate of suicide among any profession was coming from healthcare workers. And that was even before the pandemic and all of everything that was going on with that. So it's a group that does so much, and they need resources, but they're also a group, not to generalize, but you guys are the caretakers. So typically you put others' needs before your own. And so we kind of were trying to shift that a little bit so you get your needs met too. So that's kind of where I'm at.
Yeah. And that's so important to note that you went from high-risk adolescents to now healthcare workers. I mean, part of what I'm going to say is a little bit tongue in cheek, but it's also very true. We kind of are like high risk adolescents because we have all of these emotions churning inside of us. We're dealing with all of these conflicting feelings. We don't really know how to take care of ourselves because we have so much going on in our lives. We're definitely in transition because of everything that's going on with the pandemic. So I feel like there's all these parallels between healthcare workers and adolescents, that kind of like growing pain stage. And we're definitely in a period now where, with a big portion of the pandemic behind us, we've been through this huge, painful period. And then now with everything that's kind of the wave coming at us again, there's so much uncertainty. There's so much kind of dread and people that have already been through so much. And people don't realize that it's not just about like the long hours and the physicality of our jobs. We witness a lot of suffering. We internalize that. And for some people, it's not just like, some people don't have any other outlets. Some people do have those days where like they go to their 8 or 12 hour or even 16-hour shift. And then they go home and they have families that need them. And then they're so exhausted that when their time with their family is done, they go to bed, they get up, they go to work, and it's a continuous cycle. And maybe they don't have those minutes to themselves. Or maybe those minutes to themselves are literally just that, like minutes. So I'm most interested to hear about your work, kind of the topic that we're here to talk about today, even though you have a huge body of very interesting work. We're going to talk most about the Caring for Our Caregivers program, or the initiative, as I've seen it called. Before we dive in, will you kind of give an overview of what this is? And then once we kind of know what this initiative is, we can talk more about the content itself and what we hope to accomplish.
Absolutely. So as I said, we were thinking about, and we were doing a lot of workshops prior to the pandemic on burnout with healthcare workers and medical residents and all of that. And when the pandemic occurred, and this is back in April 13th of 2020. So this is really early on in the pandemic. Because we've got burnout on the brain, our concern was our healthcare workers are completely overwhelmed and we don't know how they're going to make it through this, right? Because as you said, not only were the hours just absolutely ridiculous during this time, if one person gets sick or has symptoms, they're out for 2 weeks. So now you've got understaffing, you've got not only fear for your patients that you feel a sense of responsibility that you're supposed to help, but you don't even know what it is that you're doing. At the very beginning, it was like, what is this? What are we dealing with? You've got the concern about do I have it when I come out of every room? Do I have it? Am I going to get it? Am I going to give it to my family when I get home? Are they going to be suffering? And then on top of all of that, you are like the sole support for people now. So not only physically there, but like emotionally there, because family members can't be there. Incredible amounts of stress on them. And so we were thinking about how do we help them? Now, there were a lot of, everybody kind of came together at around that point to help out the healthcare workers. There were a lot of initiatives, a lot of apps were giving away free resources, which was so great. My work is, a lot of my own clients in therapy are healthcare workers. And what I was seeing is, and how burnout works is, you're not going to want to deal with it when you leave. When you leave the hospital, you're not like, let me go and take some time. I mean, maybe some people are.
Not many.
You're not going to download an app. You're not going to open it. It feels like work. Everything feels like work. And so we realized, okay, it's not something they need at home. It's got to be in the hospital. Because the other thing I was hearing was my clients were telling me that the break rooms, if they have breaks, people are just sitting there staring into the abyss. Like it's like this, like shell shocked, you think of like vets in the war system, and then what I also know from my own work at hospitals in terms of wellness work, we know that we teach one another, we teach everybody the signs of burnout, because oftentimes you don't realize it's happening to yourself because you're just go trying to get through. So you recognize it in one another, though. And one of the ways that we've always taught burnout is also to recognize it in your fellow, your colleagues, so you can tell them you need to take a break. Like, you don't realize you're reacting to this. So we figured, okay, that would be a good way to go. So they can have something in the hospital, just something there to take their brains and their minds out of everything that they're encountering, give them a moment reprieve. So that was kind of how we started all of this.
Sure.
And then we were looking at what to use, what would be beneficial. And so the Sufi meditation method, tamarkoz, is one that's been used at hospitals, it's been used at universities, and the recent research on it that was just published in Nature's Scientific Reports magazine showed that it decreases perceived stress and increases positive emotions in times of increased stress. So we're like, perfect, this is what is needed right now. And this method of meditation, what's really great about it is it includes multiple components. So it's not just mindfulness, which is great, but some people that doesn't work for them. Mm-hmm. Sometimes some of the practices are deep breathing. Some of them are visualizations. Some of them are meditative movements called muwazanah, because people need to move for some people to kind of release some of this stress. So by using this method, we were like, okay, we can use multiple components. People have different ways of operating. And we teamed up. There's a Tamarkoz app, and they were kind enough to give us the videos that they use on the app, because the other issue during this period was we wanted to get this to them. We don't want to give an electronic thing to the hospitals, because at that point, to get it into the hospitals quickly, we don't have time to go through jumping through all the hoops with Wi-Fi. So if you try to give like a tablet, the issue is then they have to review the whole thing because of concerns of viruses, what can get into the hospital system if it's hooked into Wi-Fi. Like, there's a lot of precautions. Right. You don't have the time at that point. We just want this in the hospital. So we dismantled everything on these tablets, except so there's no Wi-Fi, and the app actually gave us the videos. So we just downloaded them directly, old school, onto the tablet and donated them with individually wrapped disposable headsets. We made sure everything can be wiped off, everything could be cleaned. So these baskets with tablets and headsets were placed in different areas depending on the hospital. And so that way the staff had something in that moment. The videos would range from 3 minutes to 30 minutes. They can use them before or after a shift, or if they're having a particularly difficult time and they just need a break, like something to take their brain off of it just momentarily, like a visualization, fine. Like, at least it gives my brain somewhere to go instead of reprocessing this that I'm encountering and that I'm deeply in.
Right. Yeah. I've had moments at work where, whether it be a really difficult situation or just moments where there's so much mental and emotional stimulation that I've had other nurses say to me, like, you seem overwhelmed. Take 5 minutes. We'll cover your patients. Like, we are caught up. Sometimes nurses are able to do that. So even if it's not your like prescribed break time, what's that break time? There have been times where nurses have said, like, I can tell you are at a critical point here and you need a few minutes. Go take a few minutes, go sit down. And that would be a perfect instance where I would be like, okay, I need to detach my brain. I need a solid 3 to 5 minutes of like not being in this space. And that's a situation where even I would go to like YouTube or, whatever song on my phone to try to get out of my head for a minute. So I've even had those experiences where I'm like, I just need to take off my shoes for 3 minutes and not be here in my head, so I can see how that, yeah, exactly. Set a timer on your phone and it may only be like that many minutes, but I've had shifts where that many minutes was the thing that made me go, okay, I can do this. I can get through a little bit longer, because sometimes in those moments, you're not thinking like, oh, I've got to get through a 12-hour shift. You're thinking, okay, I've just got to get through MedPass. And once you get through med pass, you think, okay, now I just have to get through my assessments. Okay, now I just have to make it to lunch. And some days you do have days like that where you're like, I'm exhausted. I need to rely on my team. I just need to get to those benchmarks. And so sometimes if one of your benchmarks can be, okay, I can go meditate in the supply closet for like 5 minutes. To some people, it sounds maybe, a little like, oh, but I have had that experience where I'm like, okay, those were the 3 to 5 minutes that made me go, all right, I'm not going to burst into tears and tantrum on the floor about how hard this is. I can keep moving. So I do think that for some people, that can be a powerful and profound escape, even if it's just for a short amount of time. So I do subscribe to this way of thinking that sometimes you just need to pull yourself out of whatever it is that you're doing. And you're right, other nurses, we do recognize that in each other, because sometimes I've had nurses say to me like, honey, do you need to eat a cookie? Because you don't seem okay. So I think you're right. I think that we need to, if we're not recognizing it in ourselves, it's absolutely something we recognize in each other. So if I'm understanding correctly, this is a practice, this Sufi meditation. This is something that you grew up with, that is part of the experiences that you had growing up. So how do you talk to or present to people who maybe come from other faiths or secular way of thought, and how do you kind of bring them on board with this when there are maybe concerns or questions about how that spirituality plays into Western medicine? Like, can you talk a little bit more about that?
Absolutely. So, okay, and I'm really glad you say this, because I prefer people to ask the question so we can discuss it versus kind of rely on what we have, the preconceived notions we have, and then they're incorrect.
Well, how do we exactly, those preconceived notions are often based in fear or misunderstanding or what we've heard through the grapevine, which may or may not be from the source.
Yeah. So a couple of things. One, in terms of any meditation practice, you look at any practice, if you follow its history further and further, it comes from a spiritual practice. Mindfulness, that's so easily used everywhere and discussed, is a Buddhist practice. Yoga, right? It's a yogic practice. All of these come from somewhere. So that's that part of it. Now, in terms of Sufism, Sufism isn't a religion. Sufism is a discipline in self-knowledge. And what that means is that it's a practical experience. It's a teaching. It's actually a school. We go to a school where you learn to know yourself. You learn to understand more about who you are, separate out what you've gathered out of fear, what you've gathered out of anytime you feel less than, your narratives that you tell yourself, all of these things, and you kind of understand who you truly are. You understand your capabilities, your potentials. So that's what Sufism is. Now, it's Islamic Sufism in that it's a spiritual practice that's based on the principles of Islam. But in terms of the Sufi school, we've got people who have been born into a Christian faith, a Muslim faith, a Buddhist faith, a Judaic faith. People of all different faiths can attend the school of Sufism and learn about themselves. So it's not a conversion, a religion. It's strictly about knowing yourself, and you can only be a better. It'll only better your own religion, your Christianity, your Judaism, your Islam, if you have a solid understanding of who you are and you build that connection with, if you have a higher power, with your higher power yourself. So Sufism is about having that experience of using your experience and connecting with whatever it is you believe, but for you to experience it as opposed to maybe being told. And then, because what we do is we're told and then we're scared and we hold on to these things. We do this with everything, right? Superstition, beliefs, everything. And so this is a way for you. So this is a way for you to experience it. So then you know what you're following. Then when if you're Muslim and you're doing the prayers, you're not just repeating words, you're doing them because you feel this connection. You feel like you know what this is, If you are reading the Bible, you're seeing all the beautiful, rich lessons in it for yourself, that are about you, that give you guidance and give you support. So that's a kind of what Sufism is. Now, Sufi psychology is taking these teachings, which are all about learning about yourself, knowing yourself, and learning about every aspect of yourself. So in Sufi psychology, we always say is a hub basically for all the information that gives you knowledge about yourself. So there might be research on medicine, on nutrition, on wellness, on your physical body, how your brain operates. It's learning all these different ways that this physical body operates, but then also giving yourself an opportunity to do some spiritual practices that is more experiential, so that you can tap into maybe the more delicate aspect of your being if you're interested in having that, or you might just be interested in learning about at least the physical piece.
Interesting. Yeah, that's a fantastic answer. And I think that also answers a lot of questions for me, because while I was doing research, my own research, AKA Googling, which, a lot of people misinterpret as heavy duty research. But as I was doing my own Googling and reading about this, I was finding a lot of conflicting information. And I think that leads to a lot of people thinking they don't know how to piece things apart. And that's true with any information, whether it's spirituality based or not. And I think you make a really good point that all of this comes from somewhere. Prayers, meditation, yoga. And some people, they go to yoga on Tuesday and then they go out to Starbucks with their friends. And for some people, yoga is a very important practice that is very intertwined with, their spirituality and the way they interact with the world. And so we need to remember that there, like you were saying, it can be something that you use as a practice, mindfulness, to help keep yourself kind of in tune with yourself. And then there are also ways that you can take that deeper into whatever it is that you believe you practice. So I think that that's really important. And I think that that's an important distinction, because so many people are scared off when they hear tag words and they don't really understand what it is that they're pushing away. And I think people feel that way about meditation too. They think, oh, I can't meditate. Well, what do you think it is you're supposed to be doing? Yeah. Like what it is that you can't sit quietly with your thoughts and just try to take some deep breaths and chill out for a little bit. You can't. You don't have to, people are like, well, I can't clear my mind. Well, nobody's asking you to. So it's a matter of what your interpretation is and what you think you're supposed to be doing or what you think it's supposed to be. So I think it's really important that we understand what it is we're doing. And this program seems like it's definitely more applicable than what a lot of people might think just reading the title of this episode or hearing this is what we're talking about today. So I hope that people are expanding their definitions of what their lives, spirituality and such entail.
Yeah, I think I hope so too. And I think you make a good point in terms of it really, and I think we forget this, that what we get out of something is entirely up to us, mm-hmm. right? If you and I might watch the same movie and you might get, based on your own experiences, based on your spirituality, your religious background, whatever it is, you might get a message in that I completely get a different message, right? It's all about how we're taking it. Somebody might take a yoga class for the benefits, the physical benefits of their body. Awesome. Someone else might be practicing it and viewing it and looking for a different thing within that. And that's what they get out of that. Mm-hmm. So I think everything is that way, and this as well. And in terms of the research that we've done and the people we use this type of method on people from all walks of life, all different types of religious and faiths and non-faiths, everybody, because everyone knows that we exist. So if I can just learn more about myself, there's nothing here to argue. It's beneficial.
Beautiful. All right. So now I want to get sciencey and nerdy with you. So let's change gears just a little bit. So it's my understanding that you've been doing research on this, that this is not just a wonderful thing that's being done for healthcare workers that are experiencing burnout, that this is actually you seeking a little bit of practice-based. I've always heard the term evidence-based practice, but you are seeking practice-based evidence about spirituality, integrated psychology. Will you talk a little bit about that?
Yeah, so this was really interesting. So this was a back in, I want to say maybe 2017. I think that's how long ago it was. There was a so the Brigham Young University received a, I don't know, X million dollar grant from the John Templeton Foundation to research spiritually integrative psychotherapy. So this is therapy that we're talking about. And they put out a call for sites that want to do research on this. And we were one of the ones that submitted. And we were lucky enough to be chosen. I think there was like 20 sites across the globe that were chosen, and Sufi Psychology was one of them. And with psychology, one of the things that's challenging is if you try to study psychology and psychological effects the same way you would in a lab, where you're isolating that one variable and trying to not let anything else impact it to see, does this impact this? It's really hard to do that within a psychotherapy setting because everything is impacting the human being. Mm-hmm. So what they have found is, and through, years and years of research, they found that actually practice-based studies are really beneficial. They give a more accurate view of the world and of people's responses. So what that basically means is it's a bottom-up approach. It's allowing the therapist to do therapy as opposed to feel like they have to follow a script with each and every patient, to do the therapy that would match this client, and then looking and seeing what the results are for this client. And so we were one of the sites that did Sufi psychotherapy, and we were able to, we were three different clinicians, and I was in Chicago, one was in Houston, and one was in Dallas. So we were in 3 different places. We each were using Sufi psychotherapy, Sufi psychology with our clients. And quite honestly, I think maybe out of all of our clients, maybe only one of them had like an Islamic background. The rest of them were all sorts of denominations. And then they would come in, it was for a whole year, they followed our patients. So our patients would come in, they would fill out an anonymous online survey that is linked into Brigham Young, and then they would have therapy. We would also fill out what we did. And then after the end of the year, we would look at the results. And so based on that, now it's a very preliminary study because it's the first one that's ever been done on this. So, still needs to replicate and blah, blah, blah. But based on that, it was shown that Sufi psychology, it decreases therapeutic distress. So this is distress that you have about coming to therapy, seeing a clinician. Do they get me? Do they not? It decreases psychological distress, everything you're feeling in terms of anxiety, depression, trauma, and the symptomology there. It decreases, did I say increase? I meant decrease. Okay. I don't know what I'm saying. It decreases spiritual distress. So people who might be struggling with some topics related to spirituality, it decreases their spiritual stress. It decreases their critical distress, which has to do with suicide and homicidal ideation. And then it decreased the relationship distress, which is the stress they might have in terms of their everyday relationships. And what was really, really interesting about this study is that the same amount of change was found regardless of who the clinician was. Because one of the things we know in psychotherapy is that the relationship between the clinician and the client is a huge factor of change. But this was the same. So it lends itself to hypothesize that perhaps the method does not depend on who the clinician is that's giving it. It still seems to provide the same amount of change. So that's a really cool study we did. Hopefully the results, we've submitted it for publication, so we'll be hearing back. And then Brigham Young is doing an overall study on all the different types of spiritually integrated practices, because we were the only Sufi psychology sites. There were Christian, Buddhist, Muslim, other types of programs. And so they're going to do it's a huge big data research study that was done.
Interesting. Are you collecting any feedback or data from the healthcare workers that are using the tablets in the hospital setting, whether informal or formal data or feedback from them?
Yeah. So during the pandemic, because when we started this in April, our goal was just to give relief. We didn't want to even bother people again.
Right. Like, here's a survey, and can you tell us about your experience? Like, no, no, I can't.
Exactly. So it was really just to get people relief. What ended up happening was people would call us, hospitals would call us and say, our nurses love this. Can we get it for our sister location? So we're like, great. So we started giving them even more. I mean, by the end of, you got to understand, by the end of the year, so just from April to December, we were in all 50 states, in 4 countries, in 300 hospitals. Like, it just moved really quickly because they kept calling about their sister hospitals. So the feedback we've gotten has been either people asking for their other hospitals, or now they're asking, do you have other programs? Because now we're seeing the after effect of all of this, which is actually, in my opinion, much scarier, and there's more cause for concern than what was happening last year.
Yeah.
So that this has been the feedback. It seems that people have liked it. They have wanted us to do more for them, or to give it to their sister hospitals. So that has been the research from the healthcare workers. Or
have the hospitals been determining, like, where within the hospitals they're having these tablets? Like, are they going to the ICUs? Are they letting the hospitals decide? Like, how is that all worked out?
Yeah, well, we would talk to each hospital at first individually, because each hospital is so unique. Some hospitals, who quite honestly had much more funding, had little, wellness nooks in every department. They had the ability to do that. Some of the underfunded hospitals barely had even room for people to sit down. We really spoke to them about where they could place it. Some hospitals put them in the chapels. Some places had wellness rooms. Some places had little nooks. Other places would put it somewhere where people could check them out and take them. Some of them put them in the break room. Some of them actually put them in each department, but what we were seeing is a lot was happening in ICUs. They reported that ICU, ER, and oncology were the 3 units that they felt were under a lot of stress, but it was going to wherever the need was.
And did I read somewhere that these tablets have been donated, or did I get that right?
Correct. Yes. Yeah.
Wow.
We were so lucky. This entire initiative was all donated. We're a completely nonprofit organization. Nobody gets a salary. Everybody here is volunteer, and everything was donated to the hospitals. Yeah.
That's wonderful. That's great. I really do think that there are people that care about healthcare workers. I'll save my own editorializing about how I wish they would choose to show it, but this is a really nice way that people have chosen to show it by donating. So were they donating the tablets directly, or were they donating funds, or both? Or
So basically what happened is, originally when this started, there were 4 ladies, and we were trying to put all these together, and it was very, it's very grassroots. I'm talking, it was like during the pandemic, running to Target and purchasing tablets, and then coming home and trying to figure out how to program these things. It was so grassroots. And we were really spending our own money to do this. And we were trying to get funding from a lot of the tech companies and other organizations, but honestly, everybody was so strapped. They were giving, this affected so many people. They were giving to schools, to underprivileged communities, everything. So we weren't able to secure any funding in that way. And what happened was the teacher, the Sufi master of the MTO School of Sufism, who's the school that the Sufi Psychology is affiliated with and we're all part of, he he put a call out to the Sufi community and said, this is the initiative, if anybody would like to donate to it. And this entire initiative has been funded by the MTO Sufi community across the globe. And like I said, this is in 4 countries. So it was really touching that they just all funded, and we still continue to purchase, and we weren't getting any really great deals. We're buying everything, and the headsets and everything, and
paying retail.
And we were just coming up with everything and donating them. So it was so grassroots, but there was something really, really beautiful about it. And I think it was just, and not to sound super corny, but honestly, like there was never any like upset feelings or any pressure. It was all just done with so much love and care from everybody that it was really touching to see. Like, we loved this. And everybody who worked on the initiative will tell you that this initiative saved them. Because quite honestly, we're all feeling the pandemic too, but to have a sense of purpose in the midst of this and to give to others is, I'm sure, is like the story of your life. But it really gets you through.
It does, especially when it's a way that you can see, you see that it's actually like making a difference. It's one thing when you send $10 off to an organization or however much money, and you don't really know what's happening or how it's being used, or you don't see the fruition, that come to fruition. But when you're part of something and you're watching it happen and you're watching it grow and you're seeing it come to play, that's pretty satisfying. And I saw, United States, I saw Germany, I saw France. I missed the 4th one. What's the 4th country? The UK? Okay, yeah. Wonderful. So quite the spread. There's even a couple hospitals from my the state that I just moved from in Iowa. I saw a couple, Des Moines and I think Cedar Rapids. I saw one. Those are 2 of the bigger cities in Iowa. So if hospitals or nurses are listening and they think, hey, this is pretty cool, I would like to potentially have this for my own hospital, how do they get in touch with you guys? How do they learn more about the program, the initiative? Is this something that's still going on?
Yeah, we have this always going on. To be really honest with you, like downloading all the videos onto the tablets, this was really more of a crisis management, because to have those tablets long term, you've seen the videos, right? People get bored with them. It's the same thing, right? Mm-hmm. This is in the moment. So as a result, what has happened is, from hospitals reaching out, asking for more, from us looking and seeing what's happening, we're shifting. We still have the tablets, some hospitals, if they need it. Like UK is still really in the depths of it, so they're actively still giving tablets. But we've actually now shifted to creating a wellness program that's specifically for this. So typically with wellness programs, they're so focused on, they're great programs, but there are some limitations to them. And there's a few limitations. One of them, because I've been doing them, is getting everyone together for a workshop. There's no way in a hospital you're going to have one and get everyone together.
No.
Right? So they end up missing out on things if they can come. If they're there, pagers are going off, they got to go, you're distracted. So that's always challenging. They're great to have as supplementary, but we wanted a baseline program that every hospital can provide for their healthcare workers, so they're getting benefit. Most hospitals only have EAP programs, employee assistance programs, which is like after the fact, you're stressed, you get help.
It's like crisis almost. It's like last resort kind of stuff.
Exactly. So we really wanted something that is like baseline. So we've created this program where it's accessible online. There are weekly classes, as well as just some videos where people can use to target all the different components of wellness, because wellness and burnout and stress doesn't just affect you at work. It's going to affect you parenting at home. It's going to affect your sleep. It's going to affect how you communicate with your partners. It's going to affect you socially. It's going to affect your nutrition. It's going to affect like your anxiety, your bereavement. So we have a program where we are working with experts in the field, each of them creating videos and very evidence-based, up to date on the current research, creating videos, short videos with tips on how to target the different components so that, you know, when someone goes on and they're like, man, I'm just drained. Okay, but I'm stressed out about, you know, my kids, they're getting on my nerves and I've lost my patience with them. You can watch a video that gives you evidence-based techniques and tips to help you have a little bit more compassion, or how to treat them, or how to resolve, you know, because you guys need to be healthy. It's so important for our society, for the healthcare workers to be healthy. You guys are carrying us. And, you know, the research has shown that when you're burned out, there are more mistakes made, there are more diagnoses, there are more lawsuits, right? And I do want to say, you know, you asked about how people can contribute, which I'll get to that. I went on a tangent, but
tangents are welcome here.
I do want to, I'm so passionate about this topic. If you let me go,
I'm the same way.
Oh my God.
I'm like a horse in a field. I just start running. I just go with it.
I mean, no one even needs to listen, quite honestly. I will gladly read. You know, one of the things, and I really want to, this is like the main goal right now, we are trying to emphasize and sound the horns, and as much as we can, is typically, when we see people going through difficult, prolonged stress, these traumatic events and moments like this, you don't see the effects right away, right? So it's not like, great, pandemic is over, everything's done. It might be done for everyone else who's trying to move on, but the people who have endured through this pandemic, your body's just pushing you through. It's like fight or flight. It's getting you down through it. When things calm down is when you begin to now feel these effects that you're like, where is this coming from? Why am I getting eye infections? I had a nurse who was like, I've never had eye infections. I'm getting eye infections. I don't even know where this is coming from. The other one's like, I'm getting styes. What? I've never had a sty. Your body starts now reacting in different ways. Mm-hmm. Gastrointestinal issues. You know, right now I go to hospitals and I do workshops for the staff. And Adrianne, it's like you're watching, when I walk into these hospitals, like shell-shocked people, like you can tell that they're not behind their eyes, you know, they're drained, they're exhausted. I started talking about burnout. 2 nurses started crying because they're still not. Oh, yeah. So even though everybody wants to move on and be done, we're nowhere near done for them. And I think going through, and unfortunately, what I've heard from some of the administrations at some of the hospitals is that they've said things like, when we've offered to do workshops for burnout, given everything that's going on, is they're like, we don't want to draw attention to it, right? So they're kind of thinking, you know, don't make eye contact with it, it'll go away. But your workers are drowning and they might not even recognize what's happening. So that's my big warning, is that we really need, now is the time where we have a lot of work to do to help them. And so that's part of what our program is, we're hoping is going to do, is to be able to fill in some of these gaps. And yeah, people can learn more on caringforourcaregivers.org, caring for, the number 4, our caregivers.
And I'll include that in the show notes, of course, so you can find that.
We are a nonprofit, we're donation-based. The wellness program, since this is a comprehensive program and it does cost us some money to create, so we have to put a fee on it. But what we really are trying to do and come up with is a way for those funded hospitals to be able to have it as well. So we're in the process of creating a GoFundMe so that some of those that can go towards the underfunded hospitals. The more the hospitals that have more funding, it's so like the price is so nominal, like they can afford it. It's nothing. They spend more on ridiculous things. So
right.
But so that's kind of where we are right now, is working on that, trying to get the word out as much as possible, provide this to hospitals, and then get the funding.
Well, it sounds like a wonderful program. I think that, there's a lot of things systemically we need to fix, but it's like I was telling a friend, we have so many people that are in such such desperate need for ways to get through this and to cope and to keep pace with what they're doing. Like you said, some nurses, you mentioned burnout, and they just crumble because it's like a sand castle. You just poke it and it's crumbling. And so I think that for some people, we don't have the time to wait for that big systemic change that nurses need to make the whole thing better. So I think that until we see a day when we do have that systemic change, we need programs like this to keep us afloat, because there is a lot that is burning us and that is wearing us down, and we're losing nurses from the bedside. And I think that the more we can do to maintain our mental health, our spiritual health, our ability to keep putting one foot in front of the other for ourselves and our families and our patients, these are important steps that we take. And I do a lot of shows about different ways that nurses can find whatever that is, whatever that thing is, that program, that workshop, that mentality to keep them going, because it's like you've said, not everything is going to work the same for every person. So I think it's really important that we talk about all the different options that are out there. And the Sufi Psychology Association and this Caring for Our Caregivers program is yet another wonderful option that people have out there. And it sounds like you're attempting to grow this into something else that can stand long term for people as another option to maintain that healthiness and that well-being, or at least another piece in that larger puzzle that keeps us all together.
Yeah. We need to think of something. The way that we've been doing it has not worked. It wasn't working before the pandemic, and now clearly not. So it's not, this isn't like a result of the pandemic. This has been a long time coming, and we just need better systems in place.
The pandemic just like tore the curtain off, and we can just see all the mechanical problems now behind the curtain. So I think that that what you're doing is wonderful. I am really appreciative that you've come to talk to us today about this. I'm sure that like I said, I'm gonna include all the links in the show notes so that people can learn more about your organizations, the work you do, and this initiative and the continuation of these programs. So again, thank you, Dr. Saloumeh Bozorgzadeh. You have been a wonderful guest. I've been really excited to talk to you today. Is there anything else before we wrap up that you'd like to share with the audience?
I just want to really thank you for having me on. I can't tell you, every time we're on, we get any kind of press, it just gets the word out. Like there'll be an article written, and then I'll get emails from nurses in like West Virginia saying, can we get this for our hospital? So I really appreciate this. We're so small, and we're doing it all ourselves. Like all these hospitals, we were just picking up phones and calling individually. So So I really appreciate you for shining the light on this, and then having a platform where you're talking about this so much. I'm just noticing, and I've been so unaware because I'm not in your field, but so much is hidden and covered, and people just put on a smile and try to get through. But it's insane. It's ridiculous what is going on. So I think it's really important that there's this platform that you are shining a light on this and helping people have some.
I just want to continue to, I've amassed this following, these people that actually listen when I talk. So I want to make sure that I'm passing the mic as much as possible to other people who know so much more than I do about so many more things. So you're part of that army of people now that know lots of things about lots of different things. So all right. Well, thank you to all my listeners for coming back for another episode. We're completely honest, and we're always HIPAA compliant. If you love the show, please subscribe, share with a friend, maybe throw a few dollars in the tip jar at buymeacoffee.com/NU podcast. So again, thanks to my guest, Dr. Saloumeh Bozorgzadeh. Thank you for taking time to talk with me. And to everyone else that's listening, relax your jaw, stretch your neck. Take a huge deep breath. We'll talk again soon.